If this isn't an emergency, then I don't know what is an emergency. Zika is a public health emergency. It defines public health emergency, and we really have to act now to fund the administration's $1.9 billion supplemental request. And I want to respond to the Assistant Majority Leader's concerns that there is no plan. With due respect, and I know he's working hard on this as well, that's just not accurate. The legislation propounded by Senators Nelson and others has a very specific plan, and I was fortunate enough to visit with the Centers for Disease Control headquarters in Atlanta, and they have a very specific plan. It is vector control. It is developing the diagnostic tests that are necessary to figure out whether or not people are carriers of the Zika virus. It is working on a vaccine. They have a high degree of confidence that they're eventually going to get a vaccine, but this takes time and this takes resources. It's public health outreach regarding mosquitoes, regarding how this is transmitted, and it's assurance regarding the safety of our blood supply. So they have a plan, and let me be a little more specific. $743 million for CDC. This money would include grants and technical assistance to Puerto Rico and the U.S. territories and help our domestic and international response activities. About $250 million for the Centers for Medicare and Medicaid, or CMS, to increase the federal match rate to Puerto Rico, where there have been 500 active transmission cases, and unfortunately, that number continues to go up. Several $100 million for the National Institutes of Health and BARDA to invest in vaccine research and development. Now, that's the end game, but in the meantime, we have to prevent the transmission as our country warms up and as the mosquitoes become more prevalent across the country. $10 million to the FDA, vaccine and diagnostic development and review, and $335 million to USAID abroad to support affected countries' public health efforts on mosquito-borne diseases. And let me just make a couple of specific procedural points. We are in the middle of, as a member of the Appropriations Committee, it is really important for me that we are trying to move in the regular order on each individual appropriations subcommittee. We've been working on a bipartisan basis, and we're trying to move in the regular order. That is good news, and we're moving a little quicker than I think has been done in many, many years. That's good news. But the practical fact of that also means that we are not in the middle of working on legislation that must be passed by today or must be passed by next week, because whatever we do, whether it's the Energy and Water Title, whether it's THUD coming next, maybe MILCON and VA after, whatever it may be, we're gonna be waiting for the House to act, we're gonna be conferencing, and it's not at all clear when we're actually gonna move appropriations measures to the President's desk. But it is fair to say that those things are not exactly legislatively on fire. We could wait 2 or 3 days, legislative days. We could wait 2 or 3 legislative weeks. We are ahead of the game. Not to say we don't have our own challenges with each of these individual appropriations measures, but this defines an emergency. This defines an emergency. This is an actual public health emergency, which means the idea of a pay-for this is antithetical to the way we ought to work. This is what government does, and whatever your political persuasion, whatever your ideology is about the size and scope of the federal government, I think we can all agree that the most basic responsibility of the federal government is to keep us all safe. And this is a real risk. This is not an imaginary risk. This is not a trumped-up risk. This is not a partisan thing. This is, if you talk to the CDC, if you talk to your local departments of health, your vector controls, your mosquito control areas, you talk to them, they are very, very nervous, and it is increasing. The only reason that this hasn't totally popped both epidemiologically and politically is because it's still cold in a lot of places and the mosquitoes aren't out. This is a real emergency, and there's no reason that we shouldn't be taking this up as the emergency starts to happen. There is no reason we can't take a couple of legislative days to deal with that. And to address the senior senator from Texas, the Assistant Majority Leader's questions about whether or not the plan addresses his concerns about accountability, about the ability to move money from one account to the other, about backfilling the Ebola funding. Fine, those are all legitimate questions, and I think they all can be addressed. But here's my question. Why not get on the bill? Why object to a UC request that we get on the bill? All of those questions can be addressed on the floor or in committee or in conversations. There are many, many ways to address those questions, but the refusal to even acknowledge that this is a sufficiently urgent matter, that it should be the thing we are dealing with right now, that THUD could wait a week, that whatever we are planning to do next is not quite as urgent as the Zika virus. That is the point we are making today. Not that there isn't going to be some legislative wrangling, not that we are supposing that the president's request is exactly perfect. It's just that this is a real emergency, and we ought to get this thing onto the floor so we can take some action. And that's what we have to do. I know the senator from Missouri is working very hard on this. I know others are too, but we don't want this to be a partisan issue either. But to object to a request to get on this bill, I think, fails to acknowledge what a serious public health emergency the Zika virus is.